It's 4 o'clock in the morning. I'm here at VHC Hospital. I'm a physician, and I have a family member that had a spinal tap after a bout of mono that left them with some muscle weakness. So a couple things to know for family members that, or for yourself if you're getting a spinal tap, is that particularly if you're very young, you can sometimes have some headaches. And the things they say to do after that, IV fluids, you can get IVs when you have access to a hospital, but then furthermore, the initial measures would include caffeine, Motrin, those types of things. Sometimes they have to do something called a blood patch. What happens is can be a small leak, which leads to some of the postural headaches. And in this case, this is what seems to have happened. So just even getting up slightly causes intense amount of pain. For whatever reason, young people are more susceptible to this. It's thought that maybe there's something with the plasticity of the tissue around the brain, that maybe it has more tensile strength, and that increases the pressure. So one thing about long-term illnesses is that your body is going to be more inflamed to begin with. So anything that you do can trigger other things. So just know that going in, and it's something that sometimes you're not going to be as prepared for when you're told about diagnostic tests. You know, some people feel like it's a little more like an epidural. When you get the spinal tap, they have to go through the dura, and it can be something where even a flawlessly performed procedure can still, in the circumstance where somebody's susceptible to getting these headaches after a lumbar puncture, you sustain that. So what they will do at the ER, typically they'll get lactate levels to see if there's sepsis or shock or other cardiac things. In this case, the stat lactate levels were fine. Generally, these things go back to the most common things that happen as possibilities of complications, and again, has nothing to do with how the procedure was performed, just the individual. So we're going to wait it out here, hope that we get quick resolution with this blood patch, and yeah, we'll go.